Hi, this is Mike Rankin with Relational Intelligence, and today we're going to shine a spotlight on a multi-billion-dollar industry, the pharmaceutical industry, and specifically with the distribution of prescription drugs. And I have Jack Schmidt here with me, and he's with a company called RxBenefits. Welcome, Jack.
Thanks, Mike.
How are you?
I'm great.
Good.
Happy
good.
to be here.
Yeah,
First
good.
podcast experience. Already
Nice.
stumbling.
Yeah, right. Good to see you. So share with me just a little bit about what RxBenefits does, because, you know, as a consumer, I mean, I don't know, I go to the pharmacy, I go to CVS and give them my prescription and hand them some money and they hand me back a bag with pills in it or whatever.
Right,
and
right.
that's like, for most of us, that's our experience. But there's this whole ecosystem behind that, this supply chain and a lot of players. So maybe share with us a little bit about, you know, not only what you guys do, but that ecosystem.
Yeah, of course. So RxBenefits, we call ourselves a pharmacy benefits optimizer, which is a lot of acronyms in the space, particularly in the employee healthcare space, right? The PBO. And we have found an opportunity to come in and try to improve upon the prescription drug experience, primarily through self-funded employer plans. Mm-hmm. And so there's a lot of different layers to unpack there, but we go in and work with PBMs, which we'll spend some time talking about today, and try to enhance the experience both from an employer level and a member level. So that means the financial component, the clinical component, so the actual efficacy of these drugs and everything that's going on there, and then also the member experience. So everything we're doing is through the employer-sponsored plan lens, but it has wide-reaching ramifications. I mean, it's the most utilized benefit. Everybody's out there, you know, filling prescription drugs on their benefit plans. So it has, you know, individual level impacts certainly across the board.
And so share with me the different players. You mentioned PBM, right? Pharmacy Benefit Manager.
Yeah.
And what do they do in terms of that whole transaction?
Yeah. So if we're looking at a 1,000-foot view of all of the different players in the pharmacy benefit space, you know, there are a lot of podcasts could be had on that, right? But just a couple of the key ones and lay it out there. Just think about this big web, right, of all these players. It's a lot more than just you and your doctor and the pharmacist, right? So just to start way back on the end of it, you've got the drug manufacturers, right? And these are the big multi-billion-dollar multinational organizations. There's also just, you know, the startups like here in San Diego and Southern California, right? All these smaller players. They're the ones putting in the R&D, developing the drugs, and then ultimately selling them. So square one, drug manufacturers play a huge role in this whole ecosystem, obviously, right? And they have their thumb on the scale in a variety of different ways in terms of how their drugs are distributed, how people are learning about their drugs through direct-to-consumer advertising, all the like. So that's player one. Player two, drug wholesalers. There's a couple major ones, but they're the ones that are aggregating and purchasing these drugs from the manufacturers at scale and getting them to the distribution channels, right? So that's player two. Player three, the actual distribution channel in terms of how people are accessing these drugs, the pharmacies. And that could be CVS, Walgreens, mom and pop, right?
Sure.
Hospital systems. A lot of people use mail order now. So that's, you know, obviously a core component when people are going and getting their pharmacy drugs. And then you have the PBM, the pharmacy benefit manager. And they have traditionally sat at that intersection of the drug manufacturer, the pharmacy, and the end consumer, or the member, as most employer plans will call them, right? And so they help adjudicate the claims. So they're controlling the flow of the prescription drug and the transaction, the financial transaction the other way, the money, and making sure that everything runs smoothly. Because there is a lot of complexity that goes in there, especially when we're talking about employer health plans, the co-pays, the co-insurance, the benefit level. So the PBM is kind of the linchpin to all this.
And as the PBM, I know as a consumer, I see that there's maybe on my health plan, there's tier 1 and there's tier 2 and tier 3, also known as the formulary list. Are they also the ones that are kind of directing that formulary list that the employer purchases?
Absolutely. I mean, that's one of their core competencies is what they're doing is they have these members, all these people that are on their plan. The drug manufacturer wants access to those members, right? Because that's an aggregated population, right? Path to a lot of people. And so the drug manufacturers and the PBMs engage in contract negotiations to set the price of the drug, to be on the PBM's formulary or drug list. So they are constantly negotiating. New drugs come to market or they're re-upping their price annual. I mean, it's just constant conversation, right? Constant negotiation, setting these prices. And that's with the drug manufacturer, right? There's also the constant conversation, negotiation, and contracts with the pharmacy. So where people are accessing the drugs. So the PBM is negotiating and contracting with the manufacturer and with the pharmacies too.
Got it. And then we hear a lot about rebates, and I think that certainly in the industry, it's more known. To consumers, they really don't have any idea that this is going on. But share with me, what is a pharmacy rebate, and who ends up with the money?
Yeah. I mean, it's a core component, and again, even in the employer benefit space, depending on what type of plan you're in, your employer or your plan sponsor might not be fully accessing those, and we can certainly spend some time talking about that. But rebates exist with the majority of brand drug transactions. So the drug manufacturer,
So a brand name drug,
the drug manufacturer of said brand name drug wants to be on the PBM's formulary or drug list. Not only are they giving them certain pricing, right, and contracted pricing for the actual cost of the drug, to be on that list, they're also going to pay them a rebate to be on that list. And so every time a brand drug transaction occurs, for the majority of brand drugs, there's going to be a rebate attached to that too. And so that is going from the manufacturer to the PBM.
And is it as simple as thinking about it, like when I hear the word rebate, I usually think of new cars, right? If I go buy a new Suburban and I might get a $3,000 factory rebate.
Right.
I mean, is that essentially a similar idea?
I mean, if we want to put a dollar example behind it, drug A costs $1,000, at the pharmacy at point of sale. That's a negotiated price that occurred, and on top of that, there's a $500 rebate. So that's coming on the back end. The PBM then goes to the drug manufacturer and says, "Hey, we filled this script. We got the script filled through our membership. You owe us that dollar," and that's billions of dollars just with how much money is in this industry.
So there's literally billions of dollars flowing through in these rebates, and then it's a question of, does that stop at the PBM, or in some contracts, the employer can actually take advantage of those and re-divert it back to the health plan for the benefit of the participants, ultimately in bringing down costs.
Exactly, yeah. And so why the consumer should be concerned about this, and the end user, they might not be seeing the rebate dollar per se, but it is influencing the cost of their employer's health plan. And if they're able to leverage that, it then parlays into lower premiums, better plans, et cetera, that the employer can then offer.
And so that's, as an individual, some of us are on, group health insurance plans, some may be uninsured. But when we're looking at that, I know from my perspective, I have always liked being on the high deductible HSA type plan, because those drug cards, there isn't a copay system. And that's what I find interesting about the copay system. If you have a $10 generic, well, that drug may actually only be $3. Right. And so in the attempt to kind of levelize that benefit program, you're actually overpaying for some of those drugs, which I've always found to be interesting dynamic, which is why I like the high deductible, coinciding with the HSA, obviously for long-term investment and security reasons. But so as an individual, what might, if I'm an employee of a company, it's hard for me to go say, "Hey, are you guys," or maybe I work for a small employer. Maybe we've got 10 employees and we don't have the scale to do self-funding or PBM carve-outs and things like that. So what can an individual do in your view?
I came into the industry not just solely focused on pharmacy, but through healthcare, right? And doing employee benefits at large for all, healthcare and pharmacy. And in my mind, it's always just been, you got to be a conscious consumer, right? And I think that even doubles down more when we're talking about pharmacy. And I like to think about it personally, like with the analogy of car maintenance, right? We're going to go and we're going to shop. When we need car maintenance, we're going to go shop, right? We're going to go get prices. We're going to go check. We're going to do that. When we're going and getting our healthcare, when we're going and getting our drugs, we just go where it's convenient. We don't do any sort of shopping. And so there's a lot of tools out there, and there's a lot of public attention right now, social media attention, legislation on making transparency more available for the end consumer. And there's a lot of great companies out there that are doing this. Good Rx is one that I think we've all heard of. So when you're on the HSA plan, I'm on the HSA plan for our company as well. Just going and price checking, right? And making sure that you are getting the most bang for your buck, because with the HSA plan, you got to meet your deductible first, right? So you want to make sure you're stretching your dollar as far as you can.
Exactly.
Doing that shopping, that due diligence on the front end, is paramount to everything else.
Yeah, and we love Good RX. We recommend that people use it. Sometimes I think people, employees, participants really need to be aware if they do find that $3 drug, they're not using that copay, it does not go back, towards their EOB and their out of pocket.
Right.
But if it's an occasional $2 or $3 drug, I'd rather do that than have it go back as a claim.
Right. With those generic drugs, if it's not super impactful in terms of total spend, it makes a ton of sense with like a company like GoodRx or all these other discount, copay cards out there, coupon cards.
Yeah. And then as an employer, what might I be able to do to affect some greater change? And I imagine the answer is different between a small employer and a larger employer that has more scale.
Absolutely. I mean, when we're talking about, the banking fundamentals of self-funding versus fully insured, it certainly differs whether you're a smaller group or a larger group with scale, like you said, and can kind of tolerate different levels of risk. So, I'm biased because I operate in the self-funded space.
Sure.
I think self-funded is a great solution for a lot of different employers. But again, helping your people be conscious consumers. So if you are going to set up that HSA plan, give them the tools and the education on the front end to make sure that they have, availability and access to go do that shopping, right? To do that price checking, and just seeking transparency at the aggregate level for the group too. Right. So no matter what sort of funding type you're on for your plan, trying to get as much data as you can, and that's available to different degrees and
different sizes
and different states and all that.
Right.
Yeah, exactly.
Yeah.
So just having that transparency, having that data, makes you more empowered, to make your decisions as an employer level too.
Yeah, well, and I think we're gonna see more and more of this as the transparency legislation kicks in. I think we're going to see more and more opportunity. While there's a lot of information out there and it can be confusing for people, I think if we can get some of these tools in everyone's hands, so I think it's both. It's on the participant side and then the employer side as well. So if we're able to break some of that information free that people can use, hopefully we can start driving down some cost.
Absolutely. I mean, we're kind of I don't want to say it's a watershed moment in the industry, but there is a lot of attention right now, albeit whether it's LinkedIn posts or TikTok posts with some of these drugs that are out there. There's stuff going on Capitol Hill right now.
Yeah.
There's a lot of different activity and conversation happening that hasn't really happened before. So I think we're going to be seeing a lot of change in terms of what's available to the consumer and to these employer groups.
Yeah,
absolutely.
I agree. Well, Jack, thank you very much for your time. Really appreciate you stopping by, and thanks so much.
Yeah, appreciate it, Mike. Thank you.
Okay, you got it.
See ya.